Hello, good evening, dear dosto. So I hope you all are doing great. And today's topic for discussion is PCOS to pregnancy. So a lot of people already know about PCOS, and I'm sure you guys want to know: is it possible to conceive naturally or through IVF? How is it possible to conceive through PCOS? And so today we have an amazing guest who will be discussing about her own personal story. And to give the introduction, I'll have to wait because I think we need few more viewers to join in. Once they join, we'll discuss further. We'll just wait for a few more seconds and then we'll start. In case if you have any questions during the live, please feel free to ask, and our guest will surely answer all your queries as well, along with her own personal story. Okay, so to begin with, our guest personal story. She was 22 years old when she got married to an army officer, and she had this lovely married life going on. And after 5 years of marriage, when she decided that she wants her child, she was unfortunately diagnosed with PCOS. Yes, it disturbs, but she's a pro. She decided to manage her PCOD, and then today she is a proud mother of two amazing and healthy kids. Obviously, दिमाग में यही आता है कि कैसे हुआ होगा, how did she manage her PCOS and what helped her to conceive, not once but twice. So to discuss this journey, we have today our guest, Miss Anita. She's also our senior fertility yoga coach. So let me invite her. Hi, Anita.
Hi, Bhavna. How are
How are you
you?
doing?
I'm good. Thank you. How are you?
I'm good. You're looking gorgeous as ever. I mean, no one can even
Thank
guess that
you.
you're the one who has been dealing with PCOS since so long, and you look so fit. You look so lovely. I hope people get inspired too.
Thank you. That involved a lot of hard work there.
True, true,
So yeah, we'll
true.
talk about it.
Exactly. So our viewers, Anita, I mean, you guys know who is Anita, but still to give an introduction, she is also one of our senior fertility yoga coach, and she's been helping a lot of the women dealing their PCOS and other infertility issues as well. So today she is here to discuss her own personal journey from PCOS to pregnancy. So Anita, my first question to you is, how did you come to know that you are having PCOS, and how was your reaction to it after knowing it?
Okay, this is like every couple, when they want to go for a child. So we also decided, and when we decided, things didn't work out in a natural way. So trying after months, then we decided to go for the investigation. So we underwent the series of investigations. So that's how I came to know that I have PCOS. So the awareness, it was almost 12 years back, 12, 13 years back. So the awareness as of now I have was not that time. So naturally you Google it and then you ask the doctor and you do everything do to learn about the thing and the remedies and the treatment and everything. So as other women, I also did the same. So it was a bit shocking for me because I thought, planning babies and delivering babies, it's just like a, cakewalk. But then
True.
that day I realized that it's not easy for many women.
True.
So yeah, that's how it
Exactly.
started.
And I mean, true. I mean, a lot of people, they don't even know about PCOS. I mean, infertility is an alien word to many people still. I mean, you're talking 12 years back, but now also many people are not aware of that infertility word exists in male and female as well. So I understand कि वो एक बहुत ही shocking सा लगता है when you come to know about कि you're diagnosed with something and you seem to be very fit, you seem to be very fine, and suddenly you are diagnosed with something and you feel that oh you got a problem, so how to deal with it. So एक shock सा सबको ही लगता है, right?
Right. The survey says, 1 in 10 women suffer from PCOS. And
Okay.
many of the women, they don't even come to know that they have PCOS because the symptoms are very mild in the initial stage and we tend to generally ignore it.
True.
The simple, the body gives simple symptoms like, acne, pimples. So people take it for, skin issues or the dermatology issues and they start treating in that angle.
Mm-hmm.
So it's a very dicey thing. It needs a series of investigation to come to a conclusion that you have a PCOS.
True, true, exactly. So, how would you say what can be the early symptoms? If someone, since you said that ki people have to notice their symptoms, I mean, they don't understand it. So, how could they know ki early symptoms kya hote for one to understand that they might have a PCOS?
See, for women, they will have to look for their symptoms right from puberty, I would say, till menopause. The early symptoms are acne, pigmentation, and excess hair growth in the face. Uh, that's how the male hormones they become dominant in the body, and they suppress the female reproductive systems and the things to come out. So they take the dominant position, and that's how they slowly develop.
Okay, so all those
And these are
hormonal
the
imbalances.
yeah, and definitely the period thing is also connected. Painful periods, irregular periods, prolonged periods or spotting in between periods. So anything that is concerned with the period has to be investigated immediately.
True, true. So while you were going through this PCOS journey, and since even you were very much new towards this term PCOS, so how did this affect you mentally as well as physically? As you just said, ki it does affect a lot. I mean, into your physical appearance or physical, the way you look or the way you feel. So, what was your reaction? How was your reaction towards it?
For me, there were no external symptoms at all. No pimple, no acne at my reproductive age. But in my
Hmm.
teenage, I did had the pimples and everything. So even I neglected for skin issues. So later I realized that, those were the early symptoms that came into my mind. So it was a bit shocking when I learned because the treatment is all symptomatic. The
Hmm.
whatever treatment exists nowadays, they treat to the symptomatic level. They give the combination birth pill. The moment you stop the birth pill, everything comes back. The symptoms comes back, or
Hmm.
they put you on an insulin resistance or insulin sensitizing pills. So they
Hmm.
also treat symptomatically. So
Okay.
for PCOS, we have to treat to the root level,
Hmm.
and that takes time. And
True.
during that time, you are already in the urge to have a baby, and you want to go into the phase of motherhood. So everyone they just lose out patience and they want to try
True.
out everything that comes in their way. So but that's how I tried. So doctors put me on some medications, and for me luckily it helped. It helped to reduce the uh, thing to a certain level,
Hmm.
not completely I would say, because this is a lifelong condition.
Hmm.
So that's when I opted for IVF because it was like almost 6 years of marriage. So I opted for IVF.
So you mean to say that physically and mentally it does affect you, you get impatient because as you said, yes, it's a fact that during that period you actually start with your dream of becoming a mother, and then these hindrances come in between, so it does affect you, like impatient ho jana, kind of having anxiety issues as well, or having visiting doctors. These all, I think it affects you a lot, right?
Yeah, it does affect because month after month you want to see those two pink lines, but
True.
you disappoint. All you
Exactly.
get is the disappointment. So it takes a toll of the body. It screws your mental well-being also, and the peace in the relation, everything goes for a toss. The people
Exactly.
start speaking, so you are on the social pressure. Or you see all your friends are getting pregnant and you are going for baby showers and you're not getting pregnant, so it takes a big toll on the mental state as well, and this it increases the stress level to a great extent. And here in PCOS, you'll have to maintain the stress at a lower level, or I would say nil level, but this is not possible at all
Not easy.
in
True.
this case. Yeah.
Exactly. So once knowing that you were diagnosed with PCOS and knowing the fact that there are a lot of, it's a lifestyle thing and it's got to be there for very long. So what all changes did you make to your own lifestyle that helped you to manage or control your condition? So what was those changes?
Okay, so that's when I started, taking health seriously. So we started to shift to a healthy lifestyle. The simple changes like sleeping early and waking up early, little bit of exercise, and then watching something nice to keep the mind away from those thoughts, and talking with friends when your mood is off. You just went out to your friend or relative or anyone that you feel that they can console you or they can understand you. So I tried to find out the coping mechanism, and yeah, it helped along with the medication. It helped a lot, and then slowly and steadily everything came under control. And when
Mhm.
I opted for the treatment, luckily it worked for me.
Great, great. So, viewers, I would like to tell you here that she's saying it very clearly that along with the medications, you need to talk about it, because physically doctors will treat you. You're taking good precautions. आप अपने healthy lifestyle की तरफ जा रहे हैं, but mentally you will not be at peace unless you talk about it. You don't have to be just go out and bold to everybody and speak about it, because not everybody is that open. People are reserved. Society taboos होते हैं, stigmas है. But then you can find somebody, at least one person जिसके साथ आप open up हो सकते हैं, talk about your issues, discuss with them, and this will heal you and this will make you feel better. So I think physically and mentally आपको खुद से ही बहुत सी कोशिशें करनी पड़ेंगी. So this is what helped Anita as well. So Anita, I also wanted to know that since you're now a yoga teacher, so I'm sure yoga has helped you a lot. So when did your
Yes.
yoga journey started? I mean, what made you feel that yoga is the one that can, help you in this difficult journey?
So the first one, naturally, everyone is impatient when trying for the first kid, especially. So I was also impatient, and in between the treatment, I opted for IVF. So that clicked, and everything worked well. But when it came for the second conception, once you go through the procedures, you don't want to go through that once again at all, because that involves whole lot of medications, and so many procedures involved. The investigation procedures itself is painful,
True.
and the treatment, it takes months together, and it's not a sure short treatment also.
Exactly.
For me, I was lucky in the first shot, but it's not going to be the same every time. So that's when I decided, if at all I want to go for a second one, I will have to prepare myself, and it has to happen naturally. So that's when I shifted my lifestyle to a complete healthy one. I
Mm-hmm.
started following yoga, and then
Okay.
I started to eat clean and sleeping on time. maintaining the hydrations, so everything. So I worked holistically on myself consciously
Mm-hmm.
to go for a natural conception, and it did
True.
help in my case. But
Great.
it's not a it's not a overnight thing. It
True.
took me years together, I would say, 3 to 4
Exactly.
years.
True. So your first, the time that you conceived first, made you realize that how difficult it's gonna be if you want to have your second child. So I think it's after your first child that you took up yoga very seriously.
Yes.
Okay, great. So yeah, things like it's not just yoga, but then it's yoga, it's your mental health, it's eating food properly, having a healthy lifestyle, and good habits like early to bed, early to rise. जो छोटी छोटी बातें हमें स्कूल में भी सिखाई जाती है, but we don't take it that seriously. So I think these things are to be taken seriously if you want to have a healthy lifestyle, if you want to get rid of PCOS as soon as possible, and have a healthy pregnancy. So, Anita, as you said, like after having a first child, you got to know that how infertility actually hits and how hard it hits. So, when you were trying for a second child, were you very clear that I'm not going to go with the IVF or other treatments? Because I think you have already tried for IVF, you also even tried for IUI, right?
Yes.
Okay. So, then
So
what
I was
strength
very
that
clear
you
about
had?
that.
Hmm. I'm thinking that what strength, I mean, how did you get that strength that to have a second child? आपके भी दिमाग में एक बारी तो वो आया होगा ना कि what if I'm not able to conceive naturally? What if I have to go through those procedures again? Or were you confident that I have worked on my body, so it's gonna not be that difficult? So how did it
See,
happen?
first thing is the belief. Once you believe on yourself, you should not give up on yourself. At least I believe that.
Mm-hmm.
Okay, so once you believe, then you'll have to work towards it.
True.
And I also did the same. So I worked towards myself. So once the belief and the preparation is going on the right path, then once one day or someday it'll come together.
True. Mm-hmm.
So that, yeah, that was
Not to
in
give
my
up.
case also.
Great. So
Yeah,
you
should
didn't
not
give
give
up.
up.
You kept on
And
trying.
most important, you should believe in the process, should believe
Mm-hmm.
on yourself.
Great. That's awesome. So I think this
It
belief
will
and
take
that.
some time. It will take some time because it's very it's very difficult to keep up the faith throughout. At some point or the other, because you don't see the progress immediately. It's not an overnight thing. It takes
Exactly.
months together to build up, and people tend to give up.
Hmm.
So it is very important to hold on to yourself, hold on to your faith, hold on to the process, and it helps.
Exactly.
And I've
So I
seen this.
think
It helped in my case.
true. So to the viewers here, people who come up and ask us that मैम 3 महीने में 3 महीने का कोर्स में आप हमें कैसे भी कंसीव करवा दो और even after a month they come and tell you कि मैम कुछ changes दिख ही नहीं रहा है. So it's a live example. Anita didn't achieve the second pregnancy through just a month or a 3 month course. It was a long journey. She was
three to
dedicated, she was
four years, I would
persistent.
say.
True, true. That's a long journey. So it's not just कि आप 3 महीने में आप अपना like it's not working for everybody कि आप 3 महीने में अपने PCOS को आप मैनेज कर लेंगे क्योर कर लेंगे ऐसा नहीं होता you have to give time you have to be persistent towards your goals if you want to be healthy आप एक दिन में unhealthy नहीं होते तो आप एक दिन में healthy भी नहीं बन सकते so you have to give time to yourself time to your body to your mind so that you come up to a level where you are mentally prepared that ये हो जाएगा pregnancy will come to you so don't give up hope on that the
So
way
you
Anita
will
did.
have to include you'll have to include the workout, whatever form of workout you want to do, either yoga or anything that you are into, but include that workout as a habit. Habit is that
Hmm.
thing. It's a routine which you do it every day, over and over and over again. You
True.
won't get bored of, right? And
Exactly.
I've seen many people, who work out for 2 to 3 months, 4 months, and they're like, अब बहुत हो गया. I want to take
As
a
you said, they
break.
get impatient. True. Yeah.
Yeah, so it is not like that. It doesn't work that way.
True.
See, if you're eating, it's like you eat, you breathe every day. Your workout should be like that, everyday thing. See, if
Exactly.
you're bored of eating dal chawal every day, you eat biryani for a day, but you don't skip the entire day. You don't skip the meal the entire day,
True.
right? You may try a different cuisine, but you come
Exactly.
back to dal chawal on the next day because you get satisfaction on that only. So
Exactly.
it works that way. So if you want to
True.
take a break for a day or even a 2 day or even 3 day and then come back. Now don't
Exactly.
take a break for 15 days or a month, then you're back to square one. You've
True.
worked so hard and you're almost there and then you're taking a break. So you're going back where you started.
It's all zero then. God,
Yeah.
true, true. Yes. So the people who just tend to give up hopes, या जिसको लगता है कि अब नहीं हो रहा है, this is the motivation that you can take breaks, take break, mini breaks. It's allowed. जैसे हमको cheat days होता है, आप breaks भी लीजिए. Take your break, feel better, feel good, and then come back. Come back to your schedule because आपको अपना goal clear होना चाहिए that you have to have a fit body, to have a fit mind, so that you're able to allow a baby coming to your body as well. So that's beautiful, Anita. That's a good way of motivating all our viewers right here. So I just wanted to know, Anita, the people who are coming to your batch, जैसे आप आपका एक अपना journey रहा है, you totally sympathize with your clients because you know how it feels. So आप उनको क्या बोलना चाहेंगे? Like what should they think while they are joining our fertility coach programs?
Okay. This is not only about the coach program. I'm talking in general. You assess yourself. What is the problem? For example, you got PCOS.
Mm-hmm.
So this we have assessed. We have identified the problem, right? Then
Mm-hmm.
you'll have to work towards to manage the problem, right? And then
Sure.
in the meanwhile, you'll also have to work to reverse the problem, right? And
Mm-hmm.
okay, in at some point we have reversed the condition. And then we go back to the sweet own days and we start to eat whatever you like and we quit workout and everything. So it comes back. It relapses after some time.
Mm-hmm.
So after reversing, also you'll have to manage it because with PCOS, it is a lifelong condition. So you identify, manage, reverse, and you manage throughout so that it doesn't hinder your lifestyle at all.
Exactly. Hmm. True. We have one question from Khyati, and she's saying that can a person have PCOS and thyroid together, and how to manage them differently through yoga?
It is possible. It is very much possible because PCOS can be one condition that can hinder the conception. There may be underlying many conditions like thyroid and diabetes, hypertension, any other ailments also can play equally in the hindrance of the conception.
Mm-hmm.
So we need to identify each and everything because for some, maintaining a healthy BMI can help in a healthy ovulation and it can help in conception also. So just
Mm-hmm.
by reducing the weight, many can conceive.
Okay.
Because there are types of PCOS. There's this obese PCOS is the maximum, and there's this lean PCOS. In my case, I have lean PCOS where
Mm-hmm.
so for many they'll have to lose out weight. So weight
Okay.
loss is the key. So they
Mm-hmm. But
have to
healthy
work
weight
out
loss.
at least 6 hours a week.
Mm-hmm.
They can take a break one day.
Mm-hmm. Fine. Great. So with that,
So
mm-hmm.
So we have different asanas, we have different meditation and relaxation techniques to address different ailments. So if we have thyroid, there are asanas to address thyroid. And for PCOS, we have different asanas. And whatever we do in the fertility coach program, we address the us we address the
Condition.
issues to the root level, yeah, to the root level, along with other therapies as well. Like
Okay.
if somebody has got thyroid, we tell them to go on for Ayurveda supplements or any other therapies, so that the treatment also goes side by side and the yoga also goes side by side, so that they come holistically and the treatment works at some point.
Great. So, Anita, you must be having many like successful cases of women coming to you with different infertility conditions, where PCOS is also one of the common one. So, how was your experience? Like, how was your experience treating them?
See, we've seen many cases with PCOS, natural conception. We've seen
Mm-hmm.
people with low AMH conceiving naturally. So, in the past 1.5 years, we've treated so many, like more than hundreds of people, through
Mm-hmm.
different alternate therapies. And in many cases, we've seen positive results.
Great.
But again, the consistency matter. Those who stayed consistently for a long time and those who worked hard on their body, the results are there. I mean, they are
Exactly.
mothers today.
Wow. Yeah, that's amazing. Guys, even Anita is a proud mother. As I said, she's having two healthy kids. So it's not just you have to think कि एक baby हो गया and then PCOS के साथ दूसरा baby नहीं हो सकता या it's gonna be very difficult. It is possible. We are bringing you
It is
live. We are bringing
possible.
you through. Exactly. And as Anita said, consistency is the key towards. You don't have to just give up in between. Don't lose hope. You do feel impatient. You'll feel low. You'll feel sad. You might feel isolated as well because your friends are getting pregnant, they are having their babies, and they are attending parties, and all aunties coming to you taunting. So this will happen. This will demotivate you, but you don't have to give up. Stay strong and stay connected with fertility dose in case if you still feel that you need a dose to boost you up, you need someone to help you, and you need a shoulder, then fertility dose is here, and Anita is our coach where she'll surely help you deal with these problems. So Anita, today you are like it was your 12 years back journey that you said that when you were diagnosed. So today, what's the status? How do you feel about yourself about PCOS?
Okay, in my case also, everything was going good. Like 4 to 5 years back, my PCOS relapsed. That's why I keep stressing you'll have to identify, manage, reverse, and then keep managing. So when we, forget or tend to, lean back, then it relapses. So I would like to tell to every woman that, PCOS is a lifelong condition. So try to
Mhm.
deal with it, make peace with PCOS. So include workout as your habit. Make it as a routine. Like you eat, you sleep, you drink, make workout as a routine because that helps to a great extent in managing PCOS.
Sure.
So I did reverse. Matlab, it took years together, and this time I approached Ayurveda, and it worked for me. So you'll have to try alternate therapies and see um, your body. Different people have different type of body, different type of hormones, and uh, not a single medicine work for everyone.
True.
So you'll have to work on yourself, try and test which one works best for you. So if
Exactly.
Ayurveda works best for you, hold on to that. Along with that, do some workout and stay healthy, eat healthy food, sleep, get some quality sleep. So if this works for you, hold on to this. You'll have to hold on to this as long as you can.
True.
That is what
Exactly.
going to help with PCOS. And
True.
taking stress is not going to help at all. You have PCOS, you have PCOS. Accept it. The
Except.
acceptance
True.
has to be there
Hmm.
and work towards it.
Hmm.
No, nothing is bigger than you. Your belief, No, the disease is not bigger than your belief. The
And
disease
it's
is not bigger
curable.
than your hard work. Yeah, it
True.
is curable, it is reversible,
Hmm.
but you will have
Exactly.
to give your body that time. If you want to see it in 1 month, 2 months, 3 months, it's not going to it's not going to work out also. I'm frankly
Hmm.
saying I'm dealing with this for years together. You can see the results. Stay consistent, stay patient, and you will see the results.
Exactly, true. So as Anita said, I mean, I just loved your two lines that you said that make peace with PCOS, and once you have made that peace with PCOS, then PCOS to pregnancy is possible. So there are a lot of P's here.
It is.
So be positive again, and it's gonna be you are the next one. I would say that do keep hope and be consistent, do practice your healthy diet, and as Anita said that it's a lifelong something. I mean, it's going to be there for very long, so you have to have a lot of belief in treating PCOS holistically, and that's where fertility dose can help you a lot, because all our services or all our coach programs are designed in such a way that they are holistic in nature. Say, be it Ayurveda, yoga, we have acupressure, and then we have diet. All these things are designed in such a way that boost your fertility health holistically. So this is not gonna, affect you very longer the way other allopathy medicines might be. So you can connect with us, follow us, and अगर आप हमारे साथ YouTube पे live हैं, and if you have not subscribed our channel, तो आप please subscribe करें. And you can follow us on Instagram, our Facebook group. If you have any queries, our group is it's a private place where you can ask queries, and experts like Anita, and we have a panel of doctors as well who will answer your queries. So you can join our Facebook group as well. Then we have Facebook page. So stay connected, and we are here to help you out. I hope we have answered the questions as well. And Anita, thank you so much for being a part of our live and discussing your personal story, being very clear, being very candid. And I hope people get inspired from you and they don't lose hope. And pregnancy is possible with PCOS, is what we want to say here. So thank you so much, viewers. Thank you for joining in. Thank you for giving us your time. Have a great evening ahead. Bye bye.
Yeah, thank you, Bhavna.
Bye, Anita.
And I would just add on the last thing.
Please.
Uh, if you have overcome PCOS, or you have find your ways to deal with it, you come out. Don't feel ashamed of what you have been through. Rather, be proud of what you have
Exactly.
overcome and tell it to the all the fellow women who are in the same journey and help them.
True. That's a very
That's all.
beautiful message that we end up with, that talk about it. Don't be ashamed. Right?
Yeah.
Yeah.
Take care.
Thank you so much. Yeah. Take care. Bye bye, viewers.
Bye.